So before we begin my video, let's discuss the definition of abnormal uterine bleeding. So what is it? It is defined as bleeding from the uterus that is longer than usual or occurs at an irregular time. It can present as bleeding before your periods or bleeding after sex. Bleeding that happens longer than normal and is heavier than normal. Remember that abnormal uterine bleeding does not occur during pregnancy. For the structural causes of abnormal uterine bleeding, I will be using the mnemonic PAL, which stands for polyps, adenomyosis, and leiomyoma. So first we will begin with uterine polyps. So polyps are round or oval overgrowths in the womb and are usually not cancerous. So if you have polyps, usually they present with bleeding. But there are some cases where the patient does not present with any bleeding at all. So if you have a history of bleeding in between your periods, you can consider that you might have polyps. How do we diagnose polyps? So as we can see in the picture shown, polyps can usually be seen on a saline-infused sonogram. So what are the risk factors for you to develop a polyp? So the risk factors for developing polyps are usually obesity, hypertension, diabetes, and advancing age. It has also been shown that polyps has been seen to be found in patients who previously had breast cancer due to tamoxifen use. So for adenomyosis, first let's break down the word itself. Adeno means gland, myo means muscle, and osis means condition. So basically, adenomyosis is a non-cancerous condition where glands and tissue which are in abnormal muscle locations inside the uterus. Adenomas are fairly common, and in fact, some studies have shown that by the age of 50, nearly 80% of women have at least one of them. And unlike polyps, adenomas typically present in young women with symptoms of abnormal heavy bleeding, pelvic pain or pressure, constipation, frequent urination, or infertility. So in order to diagnose adenomyosis, you need to see how the tissue looks under the microscope. You may also use ultrasound or MRI. So this picture here shows the classic presentation of the womb where it is boggy, globular, and symmetrically enlarged. Before we begin with the final part, which is leiomyoma, let us first break up the word leiomyoma. Leo means smooth, and oma means tumor. So basically, leiomyoma means smooth muscle tumor. Leiomyomas are usually benign and come from one single cell, undergoing expansion to form a large tumor. This has a very low chance of cancer as only 1% is reported to be cancerous. Most are benign, but you have to check the pathology under the microscope just in case. This is a diagram where leiomyomas can occur. But as you can see, they usually occur within the uterus. Things you might experience if you have leiomyomas include pelvic pain and pressure, frequent urination, or low back pain.